I'm really happy to be in this group. Spirituality always attracted me. I just want to share this title with you, Spiritual Intelligence, The Ultimate Intelligence by Tanha Johar and Ian Marshall. This book is favorite of APJ Abdul Kalam. So there should be very many things which are common between you and me. One of them is sun. Sun has its spiritual importance as well as its medicinal value. So as doctor told you all, after 18 years, I found that vitamin D is extremely important, sun bath is extremely important, and to enhance its effect, I started adding many other things, which are like diet from Ayurveda, detox from naturopathy, psychology, and ancient Indian knowledge to form a, a group which is called Indian Integrated Medicine. Gradually, from 2019, my confidence in body started increasing because I saw many results, benefits in patients which were not mentioned in books, neither in internet journals. And you all know there's a big name in vitamin D research, MF Holick, and he says vitamin D deficiency is a silent global pandemic. And the research papers started increasing so much that after 2002, they touched the sky. And you know, our country is really blessed. I don't know why do we call it developing country. We have so many good things in our country, and one of them is sunlight. Almost 9 months in a year, we have good sunlight. And after experiencing 12 years of sun bath, I wrote this book, which is easily available on Amazon. You will also find many effects of vitamin D in my National Conference Lecture 2014, which was the first lecture. YouTube address and website addresses are given. Friends, I just want to tell you how do we use vitamin D. A normal doctor starts using vitamin D and he immediately finds that there are many side effects. So how do I use it? I studied Ayurveda, only basics of Ayurveda, not the drug. And I found out Vata, Pitta, Kapha are 3 states of human body. Vata and Kapha will require higher dose of vitamin D. Pitta requires very small dose of vitamin D. Vitamin D injections can only be given in winters and rainy seasons. I never supplement calcium as drugs to patients because calcium can be obtained from diet, and the first toxicity of vitamin D is hypercalcemia. So let the body adjust its calcium levels through dietary calcium. The levels I require for treatment is 70 to 100 nanograms per ml. If you get values in millimoles per liter, just divided by 2.5. And the first side effect of overdose felt is heat, excess heat. And one more point, when it's a patient, vitamin D is sequestered in fat and it is not available for body to use. So friends, I request to study vitamin D very carefully before we start using it and avoid toxicity at all costs. Usually I find that because of the fear, everyone gives lower dose and the lower dose gives that effect which we want. The second step, I studied only basics of Ayurveda. Ayurveda is Ved. And diet from Ayurveda is the best diet available of all the diets we discussed today. There is specific diet for Vata, Pitta, and Kapha. And when the patient gets correct diet, believe me, the body gets its balance very nicely. And we require very little drugs, almost nil, to cure the disease. And you will be surprised that there was a rishi called Bhrigu Rishi, and he had written one Sanhita. In that, he had a prayer in which he said that let our Vat, Pitta, Kapha of body be in balance always. Let's come to naturopathy. Naturopathy teaches us how to detox our body, and it tells us that there are four exit gates for toxins. First is breathing. So let us do better breathing, which is pranayama. And we all know that carbon dioxide expelled out toxins our body. Second is we do exercise and sweat. That sweating also is an exit gate for toxins. Then third is defecation. Through defecation, major amount of toxins from the bodies are expelled out. And the fourth is urination. Then coming to psychology. I call psychology as the bullet train of our body because it is the fastest acting factor which changes our scenario. Just for example, a man got out of the pathology laboratory with all reports normal and he heard a very bad news. He had a heart attack and he dropped out. This is the fastest action of psychology. And the last of Indian integrated medicine is ancient Indian wisdom pearls. What all our Rishi Munis have found out over the years, and it has passed through the test of time. We cannot neglect that. We have to go back, study them, get our experience, and inculcate it in our healing powers. So the first pearl I want to present you is the book Freedom from Epilepsy, again easily available on Amazon. And I want to tell you what it does to the brain. Amazing results. It helps complete the myelination. Cerebral white matter is vitamin D responsive. Oligodendrocytes have vitamin D receptors, and when we give a normal level of vitamin D to the patients along with other requirements, the myelination is complete. Second, the dopamine system of brain is helped by vitamin D. Third, neurotrophic factors and neurite outgrowths are also dependent on vitamin D levels. There is a big role of vitamin D in psychiatry and psychological issues. Dr. J.J. Cannell is a very famous figure in psychiatry, treating patients with vitamin D alone. His famous group is Vitamin D Council, and he tells that vitamin D is neurotrophic, that it helps brain grow, neuroplastic, it helps brain mold itself, and it is neuroprotective. Vitamin D helps in neurotransmission, in glutathione metabolism in brain. And in the last, I would like to say that vitamin D helps raise the seizure threshold of brain. That means vitamin D is a natural and essential element in our body. Let me tell you that diseases are multifactorial, and majority of you must have found out. It is not like one pill, one disease. No, not possible. We have to go to the root cause of it and find out what are the factors and eliminate each and every factor. This is a plant of Shatavari, which is famous for having 100 roots. So the first factor in epilepsy I wanted to tell you is just get the vitamin D levels done and normalize them. because vitamin D will give excellent protection against seizures. Vitamin D levels, as I told you, are normal are between 70 to 100. Below 70, the results are not there, and above 100 or 150, toxicity appears. Vitamin D improves function of almost all the organs because vitamin D receptors are present in every cell of human body. When you go to, you will find in the references, there are three groups of references. One group tells that vitamin D is low in patients of epilepsy. And it's a huge, number of research papers stating vitamin D low in epileptic patients. And a smaller group is there which says that when you give anti-epileptic drugs, the vitamin D levels still go lower down because of enhanced catabolism through liver. And there is only one paper which says that vitamin D has power to prevent convulsions. So I want to tell you how there are many, many ways in which vitamin D will help epileptic patients. I told you it's a natural essential element and it's a natural anticonvulsant. Second is it improves bowel movements. In next few slides, I will tell you how important movements for epilepsy patients. You know, all the patients of epilepsy have depression, minor or major. So it relieves depression. It strengthens the muscles of heart. It improves lungs functions. So the patient can do better exercise and sweat. It improves bone strength, better lung function, and renal excretion. And can only on sunbath? No, because we can take sunbath only for 15 to 30 minutes, not beyond that. So we have to take both medicines as well as sunbath. The second factor in the treatment of epilepsy is we have to remove all the toxins from the body. And the first thing for it is clean intestines. Because as the food stagnates in intestines, it putrefies its toxin, and that is the starting point for many diseases. And the first thing we must change in our lifestyle is go early to bed and early to rise, and that is a very important factor for good bowel movements. This is a part of naturopathy and it is very, very effective. Tap water, cotton napkin on lower abdomen, below umbilicus for 30 minutes works wonders. It increases the peristalsis. Second is triphala, three phala, three fruits, amla, harad and baheda, freshly ground, that is 3 months and before. It is a natural fruit. They are natural fruits which increase intestinal motility. They can be taken lifelong, no side effect at all. And they are not just for cleaning the intestines. They have very many effects. And people have noticed if you take triphala for 1 year, 2 years, 4 years, they have noticed different and they have written in the textbooks. And the main thing I find is it quickly balances Vat, Pitta, and Kapha. And above that, we have to take water in the morning. We can start from 1 glass and gradually go to 4 glasses. It can be room temperature water. It can be lukewarm depending upon Vat, Pitta, Kapha. And we can add lemon and rock salt to it. Thereafter, we can take herbal tea, and which is according to our body type. Suppose we have Vat, so we will take ginger, dalchini. If we have Pitta, we will take elaichi, and so on. We will match our body according for the herbal tea. And the result is we get good bowel evacuation so that we can remove all the toxins from our body. Previously, naturopathy and Ayurveda had said that there is a gut-brain axis. Now, allopathy also agrees to it that when our intestines are clean, our brain functions are normal. Now, friends, I want to tell you about enema. I've studied 3 to 4 pathies and I found out I can give first rank to enema, plain water enema. When I gave enema to my epilepsy patients, I found out that they passed black and foul smelling motions for almost 20 days. See how much they were holding in their intestines. It will be impossible to treat a patient of epilepsy without cleaning his intestines. But one word of caution that I think intestines are toxin tanks in epilepsy patients. So first we have to normalize the vitamin D levels to give protection of umbrella protection to the patient for seizures and then start cleaning the bowel. If we do reverse, that is first clean the bowel and then give vitamin D, we will experience that the patients have increased seizures. Why? This is called treatment aggravation because we are expelling toxin from the body. When 90% of toxin from the intestines goes out, 10% goes into the blood and will cause seizures. So the first and foremost thing to remember is first normalize vitamin D and rest of the lifestyle modifications. I want to tell you one very, very interesting story. A patient came around 5 a.m. in the morning with status epilepticus. I gave the patient IV diazepam and almost 70% of seizures were controlled. I was not wishing to push more diazepam for the fear of respiratory arrest. Thereafter, to this convulsing child, I gave enema, and to my surprise, when the child passed motions, the convulsions stopped. Enema removes the dullness of body. Enema decreases the depression. Enema improves the brain functions. And the list is very long. Enema has very many benefits for our body. Plain water enema, very simple to take. There are 2 videos on my YouTube channel. One says, why should enema? And the second says, how should we take enema? So I just want to tell you one example when I started learning about other pathies that for good bowel movements, every pathy has a different way. Naturopathy, we found out cold napkin, enema. For Ayurveda, when we take correct matching diet, the bowels get clean like a magic. In homeopathy, they settle down our emotions and the bowel movements are very good. In spirituality, there is non-duality. So bad emotions never come in. And so the bowel movements are very good because the person lives in high parasympathetic nervous system tone. And in allopathy, we have sometimes extracted from plants, sometimes chemical, and they do the cleaning job. Then we know about the vagal tone and epilepsy. You must have seen when a patient stops convulsion, he passes urine and motion. To me, this indicates that Previously, the patient was in sympathetic nervous system tone, and at the end of seizure, the parasympathetic nervous system has gone up and the patient has passed urine and motion. In Indian integrated medicine, there is yogasana, pranayam, meditation, along with many other things. So it also increases parasympathetic nervous system tone and decreases sympathetic nervous system tone. You all know that in sympathetic nervous system, there are all the diseases. In parasympathetic nervous system, there is health, happiness, and a behavior like saints. Heard about epilepsy and AED, anti-epileptic drugs. Anti-epileptic drugs are wonders in emergency. But when we go for a long-term management, and for 2 days, if the patient misses the drugs, what we see, the seizures are 10 times more than what they were before. And this question haunted me for good 5 years. I almost asked each neurologist, what is the answer of this? Why the patient doesn't get the same severity of seizures as he had before? Why 10 times more? And after 5 years, I realized that with each seizure, the toxin is used up. And when we prevent seizures, the toxin gets accumulated and we are doing nothing to the toxins out of body. The level of toxin is very high and it gives seizures which are 10 times more severe than the previous ones. Coming to diet. Majority of patients of epilepsy are in Vata, almost 80 to 90%. And Ayurveda says when there is Vata, the favorite fat for them is oil. So what Ayurveda advocates gradually increase oil consumption as topping on the food, raw oil, not the oil which is burnt in bagar. That is useless. So when the food is fully cooked and in your plate, then you put raw oil or wo bhi ghani ka tel. Filtered and refined doesn't work. So this decreases Vata and it naturally controls epilepsy. And we gradually increase the oil consumption. So the body adapts to gradually increasing oil. And when the Vata decreases, we have to decrease the oil intake. This is the beauty. It is like, titration in chemistry. Few patients, 10 to 20% patients are in pith when they have epilepsy. So ghee is the choice of fat. And I have always experienced that patient in epilepsy, when they are in pith, they tolerate very easily. Allopathy talks of this about the same principle. It talks about the ketogenic diet. It says that when we increase fat consumption, the seizures will decrease. But what does allopathy do? It keeps ketogenic diet for the refractory epileptic patients. And it suddenly increases the fat consumption for the child or adult, and the patient starts vomiting. We have to go gradually. For everything, for the body to change, one statement is always true. You have to gradually increase the things, like gradually change the subject. Sudden change is not accepted by body at all. So the basic fundamental concept of allopathy and Ayurveda are same here. But we have to be like practical in using things. So let's talk about bones, epilepsy, vitamin. See, I had patients who had fractures, they were bedridden, and they started with epilepsy. I have patients who are on AED, and because of anti-epileptic drugs, the vitamin D levels go down and seizures become uncontrollable. And during seizures, the patient gets fractured. So friends, I just want to tell you one very important line of my this journey, that vitamin D levels have to be kept at normal at every step of life, right from pregnancy. I will say 3 months before pregnancy and throughout the life, vitamin D levels have to be taken care of. And I was talking about a patient getting fracture and then getting epilepsy. So how did this vicious circle start? He had fractures, so he was bedridden. Then he had no sun exposure, no exercise, poor bowel activity, toxins accumulated. There was an emotional imbalance because of not able to helping the family, and the seizure started. There is another vicious circle which I noted was emotional trauma as first thing in the patient. Then there was pain in abdomen, which is VAR, and then seizures. If I ask you how many organs are involved in one disease, answer I will give is all organs. But the degree varies. Like in epilepsy, brain, yes, 100%. But if you see other organs, heart will function less, lungs will function less, bone density will be less, muscle mass will be less, bowel movements, excretory system, everything will be less. But we are unable because our whole concentration is on brain and the seizures. And to tell you friends, when Indian integrated medicine is implemented in any patient, all the organs improve. And that is the beauty of Indian integrated medicine. It just doesn't control seizures or epilepsy. It improves all the organs. It is like coming back home. It is like improving our potential to the highest. So in the end, I just wanted to few cases and almost one line for each case. And this was my first patient whose parents refused to give AED. Why? Because they had seen other child taking AED and they deteriorated. And from this patient, I had to search alternative therapies to get this patient's convulsions cured. And finally, they were cured and he had great improvement in academics, sports, and in every task he did. At present, he is an engineer in army as a captain. Second case was an adult, and in adults, as a pediatrician, I found that adults are very good patients because they give feedback very, very nicely. He said he experienced substantial change after 15 days, positive attitude, confidence increased, intelligence increased, work efficiency increased, power increased, stamina increased, happy mood, organizational power increased, and so on. A big list. His famous quote was, set your belly right and your brain will automatically set right. Third patient, he had multiple convulsions, put on IIM. Fourth day, the convulsions start decreasing, and 13th day they stopped. And another patient whose puberty was about to come, he had emotional trauma. His sleeping times were haywire, bowel movements very bad, swiftness slow, and he improved in every point which I have mentioned. He had 2 to 3 seizures per day. For next 2 years, he had no seizures, plus improved potential in every field. Case 4 was hot tea felt on the chest, puberty and pregnancy followed. Urine smell, motion spell went up, seizures came in, mood. And when I gave IIM, Indian medicine, mood improved, work speed improved, stamina improved. Seizures were controlled very nicely without anti-epileptic drugs. Case 5th, there was an emotional trauma because father was transferred. Teacher scolded another child that this child developed pain in abdomen, poor academics, when IIM plus homeopathy was given. Only IIM was not working in this patient, so we added homeopathy from a homeopathic specialist. Friends, I just wanted to tell you that we have to dissolve the ego between all the pathies for benefit of patients. And now this child started coming first in the class, excellent extracurricular activities, and great confidence. Case 6 was a clubfoot neonate, plastered, had developmental delay, foul smelling motions, was on AED, later on AED plus Indian integrated. Few days he stopped to take AED and his speech started coming up as if AED had stopped his speech. And then, as he had stopped AED, suddenly seizures came in. But in the hospital, father noticed that he passed black colored motions. And when he passed black colored motions, the seizures were controlled. Then he believed in Indian integrated medicine, and now the child is fine. And this child, very interesting child, he was in class 10th, given he was taking AED for last good 12 years. When he was class 10th, he took Indian integrated medicine. We stopped AED after 8 months, and he told me that he was very weak in maths. And after stopping AED, he improved in maths. So the time taken to start withdrawing anti-epileptic drugs is 8 months. 20 to 30% patients really don't show improvement in seizures control, but they show improvement in other organs. I still have to work for these 20 to 30% patients. And this Indian integrated medicine works only in primary idiopathic epilepsy. If we have a reason in the brain, like a tumor or ischemic patch, it will not help so much. And thank you for your patient listening.